Hello, my name is Sabina Kalumbe. I am a nursing officer from Malawi, working with Kamuzu Central Hospital, Malawi National Cancer Center. I am here at BBCI for the TMC Merck Foundation Oncology Program as a nursing fellow, and I got recommended through the office of the First Lady of Malawi. Oncology care in Malawi faces a lot of challenges in the sense that we have a few oncologists, a few nurses who are actually trained in oncology, and the workload is also high. We have a lot of cancer patients recently coming up in the country, so it is very hard for the oncologists and the nurses to look after everyone in a specialized training, in a specialized way, like the way we are supposed to take care of patients using the very principles of oncology. Or with recent improvements in diagnostic tests, we now have a lot of patients with cancer coming up, and it is very hard with the few oncologists to look after all the patients from all over the country, since they have to be looked after at 3 referral centers in the whole country. And we also do not offer a lot of services. We do not have other services like radiotherapy is not available in the country. So we usually just mainly focus on surgery and chemotherapy. And for the other services, patients have to be sent outside the country, which is hard due to the socioeconomic status of most patients. The TMC Merck Foundation Oncology Program has given me a very big opportunity to learn the basic principles of oncology care that I can offer to my patients back home, and I can also teach my colleagues on how to look after cancer patients using the ideal way, and teach all the other people as well on how we can deal with cancer patients and help in eradicating the burden of cancer in our country. In oncology care, before coming here, I had a lot of expectations on offering the ideal nursing oncology care to my patients and broadening my skills in competencies and other skills that are supposed to be offered in oncology nursing care, which actually happened, and I got the chance to learn when I came here to BBCI. During the training program, I have had a chance to experience a lot of areas in oncology care, like the protocols of giving chemotherapy, using surgery and chemotherapy as well. We have also had a chance to experience how they treat cancer using radiotherapy. We have had a chance to see how they run the diagnostic tests to confirm that a person has cancer. We have also had to see how broad oncology care can go, like having palliative care. And palliative care can go as far as visiting the patient's homes even after the death of their loved one or patients, which is a new thing. It's a new phenomenon to us. It does not happen a lot in our country. So we have actually learned a lot. I have also had a chance to experience how broad oncology care actually is, in the sense that it has been divided into so many parts, and giving care is very simple if you have divided it into several segments. You can give actualized care other than just dealing with cancer in one term as a whole. For all those who have been recently enrolled in the TMC Merck Foundation Oncology Program, I would advise them to come so they can also experience what a great learning experience this is to everyone. It helps one to broaden their knowledge on oncology care and how they can actually go back to their country and improve oncology nursing services, all the shortages that are there in their country. They can actually learn everything here and then take the knowledge back home. There are no similar programs across Africa, and I would have loved if they were there so that nurses and doctors and all others offering oncology care can have exchange visit programs and see how their friends are doing when giving oncology care and how much they are advancing in oncology care. I would have loved if all the institutions offering the TMC Merck Foundation Oncology Program if they would have offered a uniform curriculum or syllabus for all the nurses learning, because when the fellows try to interact and ask each other how much they are learning, it's like others are lacking behind and others are far ahead. So if everyone got the very same knowledge, it would have been very much better. Like all the institutions can come together and share the syllabus that they are supposed to give to the fellows that are coming to their institutions, so that everyone gets uniform knowledge on oncology care when they go back to their country. I would like to recommend this institution for the knowledge they have imparted in us. It has been so broad, we have learned a lot of things, and I would like to recommend them to do the same to all the other fellows coming up, be it for nursing or for medicine or any other aspects in oncology care. I would like to thank the Merck Foundation for offering us with the TMC Merck Foundation Oncology Training Program, and BBCI for offering this great learning opportunity, for giving us a lot of knowledge that we can use when we go back to our country. And most of all, I would like to thank our First Lady for recommending so that I can come here and experience this great care and oncology nursing services that I've had to experience while here at BBCI Malawi.